Hello, everyone. My name is Brenda Gridley, Registered Dietitian with Ironwood. Today, we're going to talk about oral mucositis and common head and neck cancer side effects from treatment, such as altered taste changes and dry or thick saliva in the mouth. So what is oral mucositis? Most patients who have radiation or chemotherapy for oral head and neck cancer will develop mouth and throat sores at some point during their treatment. Radiation and chemotherapy are designed to target and kill cells that grow quickly, like cancer cells, but they can also damage other types of fast-growing cells, including your good cells in your mouth and throat. The mouth is the most common site, but it can also occur in the throat. The parts of the mouth that are most likely to be affected are the inside of the cheeks and the tongue, especially the sides and the bottom. Oral mucositis can range from mild to severe. In the mild cases, the sores may be small and only cause a little discomfort, but in the severe cases, the sores can be widespread, large, and extremely painful. It is the most common side effect of cancer treatment, and unfortunately, it can be the most debilitating. There are possible complications that patients and their caregivers should keep in mind. Pain, mucus, thick saliva, and too much or too little saliva can make eating and drinking difficult or even impossible. Decreased consumption can result in weight loss, poor nutrition, and dehydration, which in turn slows the healing of the sores and even makes it harder for your body to fight cancer or recover from treatment. An option that is often explored is a temporary feeding tube until your symptoms clear up, which can provide you adequate nutrition and hydration until you get over these complications. Another complication is risk of infection. Because there are open sores in your mouth, bacteria, viruses, and even fungi have an easier way to invade your body, and these can lead to other infections in other parts of the bodies. Also, there's an increased risk of sepsis. When patients develop neutropenia, which is defined as not enough white blood cells, they are 4 times more likely to develop sepsis than other patients. Sepsis is a complication that develops when your body is fighting an infection, and it's your body's response to the infection that causes widespread inflammation and can lead to organ damage, failure, and even death. Another complication is a disruption of treatment. If mucositis becomes severe enough, your treatments may have to be stopped for a period of time or the dosage adjusted. Oral mucositis can severely reduce quality of your life. Most patients say that it was the most difficult side effect of their treatment, but the good news is it's temporary and symptoms can be managed. There are multiple risk factors, the biggest being chemotherapy and radiation. Half of patients receiving chemotherapy and radiation will develop mucositis. Other factors include poor oral hygiene, poor dental health, use of tobacco products, including cigarettes, vaping, chewing tobacco, alcohol use, dehydration or not drinking enough fluids, which can also lead to another risk factor of dry mouth. Women are more likely to develop mucositis than men, as well as younger patients, and having other comorbidities such as diabetes, HIV, kidney disease, heart disease, etc. Oral mucositis development depends on your treatment and your associated risk factors. With chemotherapy, it tends to develop 5 to 10 days after receiving your first treatment, and it lasts an average of 1 to 2 weeks. With radiation, it can develop 1 to 3 weeks after the start, and it will likely continue throughout your treatment. Most patients begin to see improvement within 4 to 6 weeks following your last radiation treatment. Symptoms usually begin with discomfort or pain in your mouth. The pain in your mouth, you can see red, open sores that are sometimes coated with white or yellow slough. Symptoms include soreness, pain, discomfort, red, shiny, swollen areas in your mouth, blood in your mouth, white patches or pus, sores on the mouth, gums, or tongue, trouble talking or swallowing, trouble eating or drinking, and increased mucus or thick saliva. Good news is there are nutritional management tips for these symptoms. Even though it may be painful to eat, it's really important to continue to try to challenge yourself and eat and drink enough. This way it'll maintain your nutrition status and hydration and help you fight off any infection and keep your body strong for treatment. Foods that are tolerated well would be more of the colder foods like popsicles, frozen fruit, or ice cream. Also, soft, mild tasting foods such as cottage cheese, smoothies, and yogurt, potatoes, macaroni and cheese, casseroles, stews, pasta in white sauce are well tolerated. You'd want to avoid any marinara or the red sauce because the acidity might increase the pain in your mouth. You can also try drinking through a straw. This can bypass any of the sore spots in your mouth and keep foods moist with sauces, gravings, or dressings. It's really important to try to eat a diet with adequate protein because protein helps to build and repair itself, which can heal these help mouth sores in return. So you would want to try to avoid foods that are irritating or promote bacterial growth. So those would be your more of your acidic foods or citrus fruits, such as tomatoes, peppers, oranges, and also vinegar. Of course, spicy foods, any kind of crunchy or hard foods that can further cut these sores or your gums, such as pretzels, any kind of hard bread or chips. Temperature hot foods, room temperature foods seem to be best tolerated. Any alcohol or carbonated beverages and sugary foods. The sugar can feed the infection and worsen the mouth sores. So you want to try to go for foods that are more soft, moist, or liquidy. Think of something that's easier to slide down your throat, such as smoothies, warm soups, thin cooked cereals. You can thin out oatmeal with water or milk. You could add yogurt, pudding to smoothies to increase the protein content. Mashed potatoes and pasta, canned fruit are well tolerated. You want to try to take small bites, don't overwhelm yourself, and make sure the food is chewed thoroughly. As before, cool or room temperature foods are better tolerated, and as well as those moist foods that help keep your oral cavity moist and to help stimulate saliva production. So some tips would be you could also blenderize or mash foods, such as fruits or vegetables that are more hard to chew down in general. You can sip warm caffeine-free tea. Try using olive oil or vegetable oil instead of butter or margarine because this tends to help moisten the foods and it's more slippery and allows it to be swallowed easier. Suck on frozen fruit, grapes, cantaloupe, peaches, watermelon are great. You can also suck on ice chips, but do not chew them because this can damage your teeth. And also, if you are on oxaliplatin, You want to avoid any kind of ice chips for cold intolerances that are common. Also try fruit that has a lot of water. This will help keep your hydration up and your mouth moist. Watermelon, peaches, nectarines, but do try to avoid foods that have little seeds in them because those seeds can get caught in the sores and be irritating. So oral care is extremely important. Even though you might be having pain, you still need to floss and brush your teeth daily. Toothbrushing helps keep your mouth moisturized and helps prevent infection. So you want to at least brush twice daily. And using a soft bristle toothbrush, sometimes a foam brush with an antibacterial rinse is tolerated better for some patients. But do not use lemon or glycerin swabs. You'd want to use mild with a prescription strength fluoride, such as Prevident. Do not use any whitening toothpaste. They can be aggravating to these sores. But if those flavored toothpastes do aggravate, then you can just use a plain baking soda mixture for your toothpaste instead. Try to floss at least once daily and rinse your mouth out frequently to get rid of any bacteria or food products that may be caught that can cause infection. Good products to use would be like Paradex or PerioGuard. Try to avoid mouthwashes that contain alcohol because the alcohol dries out your mouth and is irritating. Avoid toothpicks. These can cut your mouth and cause further infection. Try to keep your lips moist with a lip balm or chopsticks, but avoid Vaseline because it's so thick it can promote bacterial growth. A good rinse that you can try before and after meals and at bedtime is a baking soda rinse. This will help prevent mucus buildup. A good recipe to try is a half teaspoon salt with a half teaspoon baking soda and a quart of water. You want to rinse and spit, but do not swallow. So you can prepare a batch daily and keep it in the fridge and then just discard it at bedtime. If the salt in the mixture makes the rinse too painful, then you can just cut it out altogether until it's no longer uncomfortable. Now, if you do wear dentures, it's good to remove them whenever you can to expose your gums to air. The oxygen helps any kind of healing. But if your gums are sore, just try to wear them only when you're eating. And if they are not well-fitting or loose, you probably shouldn't wear them at all. The poor fitting dentures can rub up against your mouth and further irritate the mouth sores. So there's a lot of evidence out there on using the amino acid glutamine to manage cancer side effects, especially for mucositis. The clinical studies have shown that taking glutamine may decrease the occurrence and severity. So there's a couple of brands out there. There's Glutazolve and Helios. Both are available online. And the effective dose appears to be 10 grams of the glutamine powder dissolved in water, and this needs to be taken 3 times a day. For best results for healing, the glutamine and water solution needs to be swirled around in the mouth and gargled for 30 to 60 seconds before swallowing. Using this can be used as a preventative treatment before mucositis has developed, as well as after, to promote healing. You might experience some mouth dryness, which can lead to trouble swallowing. There are saliva substitutes and mouth moisturizers out there that can help alleviate this problem. Some saliva stimulants that you can try are sugar-free gum, lemon drops, or mints. And there are saliva stimulators. Most of them are available in, over the counter. Saligen, Ceralube, Optimoist, and I have included a couple of the pictures so you know what you are looking for at your local store. Also, you can ask the pharmacist and they would point you in the right direction. If you're having a side effect of the thick saliva, a helpful hint might be to sip on 100% papaya juice. The papaya has a natural substance that helps thin out your saliva. Also, pineapple juice contains small quantities of these natural substances, but you have to make sure it's 100% juice. You can try warm liquids as well for thinning out any thick saliva. At night, or if you are sitting at home, you can use a cool mist humidifier. And you have to just make sure that the humidifier, you're changing the water out frequently to avoid spreading bacteria or mold in the air. So foods that you would want to avoid for any thick saliva would be anything that can dry the mouth out, such as caffeine products like coffee, soda, or even chocolate. Yes, chocolate has caffeine, unfortunately, but it's good. Alcoholic beverages, including beer or wine, any kind of mixed drinks, dry foods like meat that is hard to chew down, raw vegetables, breads, pastries, commercial mouthwashes that contain alcohol, any tobacco products, and irritating or acidic foods such as tomatoes, citrus, and spicy or salty foods. So if you're having those horrible taste changes, they can lead to less interest in food and subsequently a decreased intake of food and weight loss. You may find that foods that normally you love to eat just don't have that taste anymore, and they just taste off. Something I get common is that I'm eating a mouthful of coins. Even though you might be having these taste alterations, it's important to still try to challenge yourself to eat in order to maintain your weight and your muscle mass. Tips for managing these taste changes, the oral care we discussed previously, the mouth rinse of half a teaspoon of baking soda, to swish in your mouth before and after each meal to help keep your oral cavity clean and get rid of any of the off aftertaste that you may be having. Oral hygiene, making sure to brush your teeth after eating and using that baking soda and water rinse at least 3 to 5 times daily. Taking any antifungal medication that is prescribed to prevent oral or esophageal thrush. And just kind of getting the mindset of treating food like medication, kind of forcing yourself to eat. Even if the food doesn't taste good, it needs to be eaten because your body needs those nutrients to remain strong and recover from any treatments. You can try sipping on pleasant tasting fluids or eating or sucking on hard candies such as lemon drops, chewing sugar-free gum, or something refreshing like sherbet in between meals. These can all reduce any of that off taste or bad taste. A word of caution is don't eat the lemon heads if you have a sore mouth or throat due to any kind of acid discomfort, and any sugar-free candies, because they contain sugar alcohols in them, they can worsen any diarrhea. So you would want to stay away from those if you have any of those two symptoms. Try, setting the mood, eating in a relaxed and pleasant environment with your family, your friends, maybe lighting a candle or, playing some music. You can try sour tasting foods, what those sour tasting foods do is it helps to stimulate saliva production and improve moisture in your mouth. So some sour foods are like cranberries, orange juice, lemon, vinegar, yogurt, the plain yogurt, sour cream, and sweet and sour sauce. You may have cravings for spicy or salty foods. These might be the only flavors that you're picking up. They could be irritating to some people, but if you're not experiencing any of that and your doctor is okay with you eating these, then by all means try them to enhance the flavor of your food. You can also try herbs or spices. There's a lot out there to season your foods, and just acidic foods in general, such as oranges and lemons, help to stimulate taste buds by secreting that saliva. Experiment with different textures as long as you're not having any open sores that would make you want to avoid crunchy foods or crispy foods. High protein foods and supplements are really important, especially when taste blindness prevents you from eating properly. So for any of these taste changes, you can try swishing and swallowing or spitting with just plain carbonated water. The carbonation seems to help clear the mouth of any of those unwanted nasty tastes for a short period of time. That way, when this is taking effect, you can get the most out of your meal. If you have sensitive taste buds or are experiencing sensitivity to odors, room temperature or cold foods don't emit those odors that hot foods do. So try to let them cool down before you eat. And cold foods can kind of numb the taste buds. So sorbet or fruit ice, frozen yogurt, can kind of calm down anything that might be, over exaggerated. You can try covering any of your liquid supplements, like if you're drinking Boost or Ensure to get those extra calories and protein, you can just cover them, maybe even as like a little kid sippy cup or any kind of cup with a lid, and drink through a straw, because this can alleviate any of those odors emitting from the cup itself. Try foods that have minimal odors and a shorter cooking time, such as scrambled eggs, French toast, oatmeal, cream of wheat. This will help alleviate those odors sticking around, in your house when you're cooking as well. So if you do have that awful metallic taste in your mouth, don't use metal eating utensils. You can try plastic utensils or have fun with chopsticks if you can manage those, and use glass cookware instead of metal pots. Avoid drinking liquids directly from aluminum cans. Pour them into a styrofoam or plastic cup instead. A tip is tart food can offset any metallic taste. So you can try drinking cranberry, orange, or pineapple juice, or add lemon, vinegar, pickle, relish to any kind of meat or vegetable dishes. You can try marinating meat, chicken, turkey, fish in anything like an Italian dressing or sweet and sour sauce, or adding fresh and dried herbs like rosemary, basil, oregano, onion, garlic. There's a whole bunch out there that can offset those metallic flavors. So it's just sometimes about experimenting a little bit and see what works for you. Other sources of protein may be better tolerated than animal proteins or meats. So maybe baked beans or any kind of lentils, dairy products like cottage cheese or yogurt, peanut butter or nut butters can be tolerated better in some people. If you are having meat, try pairing it with a tart food squeezing lemon or lime juice on it, or eating along with a pickle. Room temperature foods are often better tolerated. And you can use sugarless lemon candies, mints, or chewing gum to get rid of that any metallic taste you have after eating your meal. If you are drinking those Ensures or Boost to help meet your nutrition needs, try to keep them cold to decrease the flavor aroma. Once they start heating up temperature-wise, they can emit more of that aroma, which can deter you from wanting to drink them. If nothing tastes good and it's just bland, tastes like cardboard, you can increase the sugar in sweet foods, such as milkshakes or smoothies. This can also increase pleasant taste while decreasing salty, bitter, or the acidic taste that you might be experiencing. Fresh fruits and vegetables seem to be more appealing to the taste buds if you're having this blandness effect, and experimenting with textures and flavors. So you can add chopped nuts, seeds, water chestnut, something to maybe change the texture of food and make it a little bit more interesting. Adding extra spices, as discussed before, like thyme, oregano, garlic is great, onion is great. Those are all kind of stronger spices. Cinnamon is good, if you were to try to use that on your cereal in the morning, or even sprinkle it on some toast. Strong tart foods like salsa, curry sauces, pickles, and also adding lemon juice or vinegar to your foods. You can, make your own salad dressings, or just pour a little bit of these on your vegetables or your starch dishes to enhance their flavors. Some common condiments that you could try: barbecue sauce, ketchup, mustard, mayonnaise, soy sauce, and sweet and sour sauce. Also, maple syrup is a flavor well picked up during this time. So, putting a little maple syrup in your oatmeal in the morning, or adding it to your yogurt or your smoothie, can help enhance the flavor of your food and drinks. So if food is tasting strong or bitter, then you want to try to go for the more mild flavored foods like puddings or rice, hot cereal, mashed potato, just plain biscuits. Fresh fruit seems to, be good for all of these. So it can help leave a more pleasant taste in your mouth. There is a little berry out there called the miracle berry, or the miracle fruit. It's native to West Africa, and it has a mildly sweet flavor, but it has a unique effect on taste buds. So it could be worth a try. It has a glycoprotein called myroculin, which binds to the tongue's taste buds when the fruit is consumed. So this acts as a sweetness inducer when it comes in contact with acids, causing bitter and sour foods to taste sweet temporarily. This effect usually lasts between 30 minutes and 2 hours, so it gives you a good window of opportunity to get some good nutrition in. And these can be purchased on Amazon. Food is too sweet or too salty, you can offset it by adding something sour, tart, or salty. So something on the opposite side of the spectrum can counterbalance any of the taste changes you're having. So for example, if Ensure is too sweet, then add something a little bit tart, such as sour cream or plain yogurt. Also, if pudding is too sweet, or if ice cream is too sweet, try stirring in some lemon or adding a pinch of salt. You can try making a sour tart or mildly sweet shake or smoothie. Make a smoothie or shake with plain unsweetened yogurt or sour cream, which has that slightly sour taste and can decrease the sweetness of the smoothie. Good thing is adding all these other little modulators in can add some extra calories and protein, which is beneficial if you're having trouble holding weight. You can dilute any of those juices or supplements with water, milk, or soda water if they're too sweet. And also you could add just a little pinch of salt to offset the sweetness as well. Another little tip is adding some frozen cranberries in liquid supplements. The tartness will decrease the extreme sweet flavors that you're having. You could try adding lemon, lime, or orange juice, or even vinegar to fruit juice and other foods. But you might want to just avoid the vinegar if you are having mouth sores and that's problematic for you. You can try adding coffee or finely ground decaffeinated coffee to a sweet milk-based supplement, or even buttermilk to a smoothie recipe. Try seasoning foods with tart flavors such as lemon, citrus, vinegar, and pickled items. If food is too salty, then try the low sodium version available in the store, or the reduced sodium products. And adding just a little bit of sugar to foods that are salty in nature, such as soups and gravies or casseroles, can offset that as well. So if food just tastes off, try drinking water, tea, ginger ale, or fruit juices, but mixing them with club soda. This seems to remove some of the strange taste in your mouth. It is also helpful to munch on hard candies such as sugar-free mints or Tic Tacs. Also, sugar-free gum and hard candies can reduce any of these aftertastes. Adding wine, beer, mayonnaise, sour cream, yogurt to soups and sauces can help disguise these tastes as well. And eat more like starchy foods such as bread, potatoes, rice, and plain pasta. But don't add butter or margarine or any other fatty modulators such as like cream cheese to these foods. If fat is posing a problem, this can kind of leave a coat in your mouth that's hard to get rid of. Try bland foods. Eggs seem to be very well tolerated. Cheeses, including cottage cheese, it has an extremely high protein content. Hot cereals, pudding, custard, rice, peanut butter, they're less likely to leave that strange taste in your mouth than foods with more of those distinctive flavors. So the dietitians at Ironwood are here to help. Kendra is our West Valley dietitian, and I am the East Valley dietitian, and we are available for appointments if you need any help with managing these treatment side effects. Also, I'd like to invite you to please visit our website for future YouTube videos coming up.
Thank you for joining us for our virtual Lunch and Learn series. We hope you enjoyed this session. There will be a replay of this Lunch and Learn on the Ironwood YouTube and social media channels. For more information regarding our supportive care services classes and events, email us at wellness@ironwoodcrc.com. Thank you for spending time with us today.